Welcome to Wednesday Q&A, where you all ask the questions and we answer with joy and curiosity. I'm joined, as always, by my amazing co-host, Kristen Williams.
Hey, everybody. Hey, Laura. Thank you,
Hi.
as always, for this amazing introduction. I look forward to it each and every week to see what you're going to pull out.
I know. I gotta get more creative.
I love it. All right, I'm going to jump right in. We had a question emailed into us, and unfortunately, in taking the screenshot, I forgot to write down I missed who had sent this. So I apologize. You will know it's you because this is very specific, especially if you are watching us on YouTube, where you'll be able to see the picture I'm going to show Laura here. So this is her question. She says, a friend of mine had a motorcycle accident last September and only, quote unquote, broke his arm. But since then, the ulna is not growing back together. They plan to place an insert by sawing out a piece of the hip bone. He sees a physiotherapist, 2 times a chiropractor who alleviates the pain a little bit, and a Chinese energy massage therapist. Do you have any recommendations of what he could do? And if, for example, doing the reset, perhaps dolphin or shoulder exercises may help? Attached is an X-ray pic. So I am going to show this on so you can see here the 2 bones where the ulna is not healing. So it is a non-union fracture. You can even see in this picture, Laura, can you see that where they tried to plate, you can see the holes in the marrow. They've tried to plate and it's not staying together.
So that's where that's the humeral ulnar joint, right?
Yeah, it looks like it's kind of a mid, it's mid front. Yeah, so that's the humerus. It almost looks like the radius. The radius is fractured.
Yeah.
Not because the ulna, this is the radius, there's the radial head.
Huh. Interesting. Well,
very interesting. So she says it's the ulna, but it's a picture of a fracture of the radius. Anyway, do we have any recommendations for her? You want to start?
Oh gosh, that's a tough one. So they did try some surgical intervention?
Based on I do believe that they did, and it's non-union. And even like I was saying, if you look at that picture, you can almost see where they have tried to put plates in and that's failed.
It's so hard on those bones because they're so little.
And they move.
It's like they move. Yeah, exactly. There's pivoting, and like putting a screw through sometimes is very difficult because of the size. It's really tricky because it's been after those early months of healing, where the stem cells would summon, the bone matrix to heal and the surrounding tissues. This is where I would go to a specialist, because weight bearing, et cetera, is probably not going to be enough at this point for that type of gap. They're going to look, there's different techniques, the PRP injection, stuff like that, where they take in blood plasma and they spin it. So they're trying to get more stem cells into an area to create, whether it's cartilage or bone regrowth. But it's really, really, I have worked with people who have had gaps, whether it's like where the patello no longer is, there can be a degree of hardiness that is developed, but that's on your lower extremities where you're really weight bearing all the time. And like to your point, Kristen, it's a spinning bone, that the ulna is spinning and the radius also is spinning, but it's not a bone that's not moving, unlike your lower leg bones, which they don't spin, they just stay in place. I really don't know what the answer would be, besides like going into a specialist who is versed in this, and besides a plate, I would think a pin would work even more than a plate, because a plate is bigger. Uh, a pin somehow between the two bones is going to limit the motion though. And weight bearing, if it's tolerated and there's not spinning involved. So that's where you have to really solidify those two bones and not let any spinning happen. So if you're weight bearing and quadruped, making sure you get that like kind of tripod of the hand pressed into the floor and get rigid in the forearm, not allow it to spin, because that's going to create some shearing, which probably feels awful, I would imagine, if this person is still having a lot of pain. Yes, the reset could be possible. A dolphin should be probably fine, because there's, your forearms are down and not letting them spin. Weight bearing on the hand is just going to be like, can you do it without any of that spinning? I don't know. It's a tricky one.
And I'm right there with you on that. I think there's a whole host of stuff that can be worked on. Like you said, the reset, most of that in there can be done because we aren't weight bearing through the hands per se. We can avoid that. And that might, if nothing else, to the individual who sent this in, just getting back to activity. This guy was he's riding his motorcycle. Clearly he is an active,
Adventuresome type.
guy. So if, getting him, if you check out my weightless in the wrist series, there's a lot of areas where just putting the fingertips down, where you're not bearing weight through that upper extremity, but still being able to move. Using the forearms, like Laura said, avoiding that spinning where just might not feel good. Now, you can live with a non-union fracture. My mother-in-law has broke her humerus in a bad car accident when she was 18. And so her humerus is essentially maybe 3 inches shorter on the left. She lives a full functioning life. Now, she can't wash her own hair and things like that because she can't elevate, but she's living without pain. I mean, it's not that he's still in that, it was September, so it's not even been a full year. He's still maybe dealing with a lot of pain issues. Obviously, he's still seeing people, but let's think on strength and function of that, keeping his shoulder girdle strong. All the things you can do in side forearm plank, where he can keep the side body strong, even with the other hand supporting, just to keep him moving and really getting creative. Again, if you go on Lit Daily, check out that weightless in the wrist series. I really had fun making that, creating classes where we weren't bearing much weight through a hand, which is basically the same thing as not bearing weight through a forearm. And then you can really have him work on activating the scapular muscles without traumatizing. What we can see in that picture is a very unstable situation. That radius wants to spin around the ulna and it can't do that. So we are both unstable at the elbow and at the wrist because of that non-union fracture of what I believe she's talking about, the radius, even though she's saying ulna. But the reset would be a great place to start.
And I would also consider like making a fist, because when you make a fist and you're weight bearing like through that, you're going to get some inherent rigidity. Once you have the hand, like the wrist spins and that spins the forearms. So it's not that you can't spin it. It's just a little bit more solid. So I would even have him try like doing a plank on knuckles and seeing if that seems to feel a little bit better, a little bit more solid, and certainly, hopefully, pain-free. But Chris and I echo, like, keep moving, find different, this is, I always feel like injuries suck, but they also provide an opportunity to work around them and move and continue to move. Sometimes people even get stronger in ways they didn't even imagine because they've had to be so creative. So don't go from, it doesn't sound like he's doing this, but like, don't let it be like, I can't do anything, or I can't ever put weight on my hands. It's just like, be a little creative with how to do it. But keep us posted because, that's those are tough injuries, these really specific areas that move a lot and that also are not inherently as stable anyway, because of that, the 2 points of movement that you're getting in the wrist and the elbow.
Yeah.
Good luck. All right. Next question. This is from Lauren Connell. She asked, thoughts on craniosacral therapy for neck and or back pain?
I can speak to that. I mean,
Yeah, why don't you go and then I'll
yeah,
talk.
interestingly enough, when I was in PT school, so here's a funny little backstory that our fans will like. When so I met my husband, and then we kind of got separated because I was still in college, he was in grad school. And then when we got reconnected, it was when my gap year after college, and I was living in Michigan and he was in Virginia. And I just so happened to have applied to the Medical College of Virginia and was waiting to get in. And he's like, well, why don't you just move down here? And I said, okay, you get me a job and a place to live and I'll move down there. Within 3 days, he had me a job at this place in Richmond, where I became the office manager, technician, jack of all trades for a very small physical therapy clinic. This is where this is going. Just two therapists, and they did all alternative. I'm not very foo-foo. I'm very tactile, very orthopedic thinking, very biomechanical. And working with these two women, it was very eye-opening to craniosacral. I had it done on me. I can, in many different forms of it. It is very unlike traditional physical therapy. At least this is 25 years ago, so a lot has probably changed since then. But people swear by it, and they would come in for injuries of everything from, it is sacral, but they were treating all the way down to the foot and knee with these different types of craniosacral therapies, because that is the theory behind it is something central nervous system related, where that's the kind of the central processing unit of the body. So yes, I think if you're in the right hands. I do believe these two therapists had a gift. They were very extensively trained. I do think it takes a certain person to do it and do it well. As with any type of therapy, I think it's a piece of the puzzle that we need to always remember, that even your orthopedic therapy, your pelvic floor therapy, your dry needling, it's a tool in the toolbox. So I have seen it work. I have felt it work. I have seen people have their lives changed by it. I don't understand it. I don't practice it. I don't partake in it any longer, but I do believe it can help. That's my story. How about you, Laura?
Yeah, I totally agree. I think it's very subtle. So for people who like to experience like a feeling of something being shifted, you have to go in there expecting that's not going to happen, because it's very subtle. The idea is like, even the skull, it was pulled together and it has suture lines, and those suture lines have fascia, so if you just imagine kind of like parts of the skull all kind of sewed together, for lack of a better word, but that sewing is soft tissue. So, think about like a baby, like they say, that little indentation in the head is really vulnerable, because the connection of the suturing of these different cranial sections hasn't happened at that age. So the idea is that all of this is fascial related, but craniosacral, unlike other fascial techniques and restructuring, is very subtle, because you're dealing with the position of the skull, the skull parts themselves, and then how that all is connected to via fascial connections to the sacrum. And yeah, I think it's powerful. And it's like Kristen said, one area, one modality, or one part that, like, if you have not had experience, it would be interesting to try. I think it's really great for people who have chronic headaches, who have chronic, like sensorial, like neck stuff, nerve stuff that is kind of comes and goes and they're not sure about, and they've tried other things, because it can be a very subtle alignment that gets everything almost, reset, just like we talk about. So, yeah. All right. You got a question?
Yeah, I do. Our friend Suze sent in a question, and she asked, does post-stroke fatigue ever go away? And is there anything that can be done to help it? My dad is 68 and had a stroke in early March. We feel very lucky to say that the damage was very minor, and the only side effects he's still dealing with are a bit of impaired function of the left arm and hand and general fatigue. Oops. He is going to therapy for the left arm and hand, but I'm wondering if there's something he can do to help lessen the fatigue. I'm not sure if this is just something that needs to run its course, or if it's something that will stay the same or get worse if it's not addressed. It sounds like he's pretty exhausted most of the time. Would love to hear your thoughts. I'm going to defer to you to start with that
I was going to say, so this is, when did he have the stroke?
Early March.
Okay. So this is super early.
Mm-hmm.
Yes, this is absolutely normal. You have to think about, he is healing in a huge way, nervous system, neurons. It is exhausting. And so I've worked in acute stages with people who've had strokes all the way up to, 10 years later, but those acute stages, and that is really a year is kind of acute. It's very tiring. And interesting, like that's a huge part of in therapy when I would work with stroke patients. I would see them for 2 hours a day in 2 different hour-long blocks. They would almost always have to go back to the room to rest. Their calorie intake was also increased during this time, because it's not that they're burning more calories, it's just more is needed, because this is like the energy they're expending on healing is a lot. And so it is totally normal, Suze. And I would just say, let those rest periods happen. It just kind of like everybody, frequency is good, but duration is not going to be there. And frequency for him might be 2 30-minute sessions a day. And then it gets up to 2 45-minute sessions a day. That's still a lot. And then rest in between. Let him, because he's going to feel very exhausted. It's just, imagine like having a really, really bad illness, virus or something, and how you're knocked out, and then just multiply that because it's in your brain. So it's a lot of healing, and it's absolutely normal. And that was a big part too, is working the endurance with anyone who's had a stroke, working on their endurance, but not pushing it, just finding that kind of fine balance of like working as hard as you can and then relaxing. And I would say, if he doesn't already have somebody who's helping on the nutrition end, it might be something to think about as well, because he is healing, and he's needing even more really good sustenance to help with that energy load. Yeah.
I think she needed to hear that, just needed to hear that this is normal, and just that awareness of how much energy we expend to heal. And his brain is healing, his brain is also rewiring. And so that's what we think of a stroke. A stroke is like a roadblock. So his body has gotten very good he's 68, 67.5 years doing things the same way. Now suddenly he has this roadblock. So his brain is having to form new pathways to do this same thing he's been doing for 67.5, 68 years. Just to tag it on to why lit can feel so tiring, is we're asking you to do the same thing. People will come. We have athletes, super athletes that come, and they are exhausted by what you and I now, our brain is so adept at doing this that it's like no big deal. But that the amount of energy it takes to find a new pathway we feel it in our own bodies when we first start lit yoga. So think about that. That's just doing something in a new way. your dad is literally finding a new path, like literally creating new synapses to use his left arm and leg and make that feel more natural to him. So that exhaustion, you can take it from when you first started lit, how tiring it was, take that, like you said, and multiply it, the virus feeling times 1,000. And you think of babies.
I was just going to say,
how
think
often
about babies.
sleep.
Like babies
Yeah,
sleep all the time. They're up
because
for
their
like,
brain's doing
they're up
that.
for like an hour and then they're like down for 3 hours.
Yeah.
They're developing, and their movement develops their brain. And the more they move, they're going to have those like, periods of like, they're taking 3-hour naps.
Yep.
I was thinking of that too. I think thinking of a baby, like a baby is not like an adult. It's not awake for 12 hours of the day and performing it even at a mid-level. It's like they're up and then they're down. And that's because, again, that's totally normal. So this is all really normal. And I love how you paralleled it with lit, because I think that's, when we always talk about the path of least resistance is the least amount of energy expended, right? And so that works from an evolutionary standpoint for lots of things. But with that, where we are now in our lives, living longer, having more experiences, our environment is so much more expansive than it was in our, early evolutionary development. We need to challenge our brains. We need that. We need to constantly work on rewiring so that we are actually more efficient, because the path of least resistance, while it might seem like it takes the least amount of energy, in the long run is not the most efficient one. So when we think about longevity, it's like, how do we live well for many, many decades? And path of least resistance is not going to do that. So it takes energy to actually make us more efficient in the end. Yeah. Great. Beautiful question. And you all can ask any questions. As you can see, we had a whole spectrum from bone breaking to craniosacral to stroke recovery, and we're up for it all. And we appreciate you sending us questions. You can always send it to us on Instagram. I'm at Laura.Hyman, and Kristen is
Yep, I'm at KBWilliams99, and you can also email us at support@lityoga.com, and that will be forwarded to us.
Yes. And as always, we love doing this podcast. We would so appreciate if you would click that subscribe button and maybe even write a review, right? We love seeing your reviews. Pass this on to other people, because we want to be doing this for decades. So we would love your support in that endeavor. As always, we're pulling for you.